Joining us in the studio now is Simphiwe Gada, Gauteng Provincial Chairperson of the Democratic Nursing Organization of South Africa, DENOSA. A very good evening to you, and thank you so much for joining us. Were you able to attend the memorial service today?
Yes, I was there. In fact, I was also in the program, so yeah.
And tell us a little bit more about the mood. I understand that even though it was somber, people were sad, but there was a celebration of the nurses in particular, those who died while on duty.
Yes. Well, it was the first step to a healing process because we'd recall that ever since this incident happened, we have never had a chance to gather, under the same roof. So we were able to, finally gather under the same roof and share how we feel about the situation. But most importantly, when you hear something and you see everything that is happening there, you are in disbelief. You feel like somebody will wake you up from a bad dream. But the minute time goes on and you see events happening, then you start to accept and realize that this is a reality. So I think many of us today were able to finally accept that this has happened. And what we need to do moving forward is to pick up the pieces and slowly, move forward. But we're very thankful to the psychosocial support which has been organized. Leaders of the, the religious community have been very helpful in terms of assisting all of us to move forward. So today was part of, I can say, was part of the first step, to a healing process, because we were able to accept, and the overwhelming support that we're getting from all stakeholders in the private sector, government, all spheres of government have demonstrated that they can work together to put the nation first and to drive, service delivery. So we are quite happy that all of us seem to be speaking, from the same, page. Yes.
Just please, if you can, confirm the figures we've been given is that 11 healthcare workers died, and we know that news is that 7 more people died today, bringing the total number of those who died from that explosion to 34. Are those the correct figures?
Yes, that's the correct figures, because on a daily basis, we continue to monitor those that are admitted in hospitals. We've got teams where certain people have been assigned to keep checking, because most of the victims are admitted in hospitals across. Down the road, Mill Park also has some of the nursing staff admitted there. So
how many are still in hospitals, to your knowledge?
Well, I did not check the final list which you were given, but I'm happy to share with you, with your producers after. But you are correct that that toll now is standing at 11 healthcare workers, but in totality it's 34 that have sadly lost us.
And those who were present, or at least were in close proximity to have an eyewitness account of what happened, particularly to the healthcare workers, what did they report back to you?
Well, as soon as you enter the gates of Tambo Memorial Hospital, starting with the security guard at the gate, you can tell that you are entering, a place that is in mourning, that is grieving. So you go up to the canteen, the mood is the same. You go to the wards, and you look at some of the patients. So there's just, that sadness across the entire hospital. I had an opportunity as well yesterday to sit with the CEO and the nursing service manager, Mrs. Malikan. They are trying to be strong because they are the management, but you can tell that they themselves, need an intervention. I never thought that, in my whole life as a leader in the profession, I would be sitting, comforting a head of nursing of an institution who was literally pouring, herself out. including the CEO, is not in a good state of mind, but we will continuously provide support to all of them. So the entire staff is just shocked because this is something that is unheard of. I mean, myself, back in the day, I was born in that hospital. So it's a hospital that is very close to many people that I personally know. I mean, I've got family in Whiteville, Davidton. Those are people that utilize the hospital. So you can tell that this thing extends to the community. So the entire Ekurhuleni is in disbelief.
Engulfed in pain.
And it could have been worse if the bridge was not there, you know, because this thing happened under the bridge.
Yes,
so if
contained.
so it was able to contain some of the you know, destruction that could have happened.
And we can see young children there weeping, parents, and
yes.
Without going back to that fateful day, but for those who are still trying to grasp what happened, how, you know, we saw pictures of the explosion and almost the extent to which it reached, but what were people reporting, particularly those in hospital? How did they die?
Well, what happened on that dreadful day is that when the truck first went under the bridge, there was that first explosion. And after that first explosion, obviously, at some time there was a tremor around the hospital, and people were wondering what is that loud sound. And when others went to investigate as to what is happening, and then there was a second explosion, and some tried to move, you know, their cars away from what was happening there, and then there was that blaze which the firefighters were trying to put off. And between the second, explosion and the third one, which was the fatal one, everybody could not believe. I mean, some of the nurses, for instance, were injured while trying to evacuate patients away from, you know, what was happening. I mean, if you go to the management floor where the CO is, so the extent of the blast, it was so huge that, windows were broken, a door, an aluminum door,
flung off.
Yes, flung off, and so the whole system, so the whole hospital was just in shock, after that, and everybody was panicking. And because of the oath that our healthcare workers had taken, we want to also take this moment and salute those, because they could have simply ran and left patients behind, but because they've taken an oath, some put their lives, at risk, and by evacuating patients. I mean, there's one nurse that is still in hospital who got injured while was evacuating children from one ward and moving them to another ward. So that's the extent of commitment that we have, in some of our healthcare workers in the public sector.
And I'd imagine the gravity of the injuries of those who suffered injury, who didn't die during the blast. Can you share with us just how serious some of those who were injured are?
It's very horrific because the degrees vary. Some have got 82% burn injuries, some 90%. And when I was doing the walkabout in the casualty area, because there were patients there, some were affected, Tsepi, so it was sad to see human skin that is burnt on the floor. That is not something that you want to see. I'm still struggling to erase, what I saw there. At least in some parts, the blood has been, washed off and so forth. So it's something that we have not seen. I mean, in my whole career as a healthcare professional, I've seen people being rescued, having burn wounds and so forth. I myself, I can say that I've not seen such a horrific thing. So that is why the psychosocial support continues even at this stage. It continues. We are grateful to those who have availed the services. The night duty staff at this stage is receiving that. Day staff continues. So it's something that, as a typical black man who comes from a township, we always joke and say, counseling is not for us. But I can tell you, to get over this thing, you need to open up and go through counseling. It's something that is beyond comprehension.
And just on that, provincial government has said that those who are victims and their families are not alone. So beyond the psychosocial support, what else would you say is needed? What else is government offering that would help not even those who are afflicted and affected, but even communities?
Well, some of the victims are foreign nationals, and we're encouraged to see that, for instance, we had the Consulate General of Zimbabwe, we also had the High Commissioner of Malawi. So our government is working closely with those countries, together with those communities, to assess what are the needs that are needed, because as things stand, there's been a positive response from the private sector, whether it's assisting with burial costs and all other needs that the family may say we need. We have got people standing by, willing to assist. I think one of the positive spin-offs about the whole incident is the fact that it has been able to unite the private sector as well as government and different political parties within the province who are willing to assist. So there's no politics at play. It's all about assisting, the community to live with this thing, to survive this thing.
Just a quick and final point. I can't remember which province it was, but nurses or medical staff basically saying this is a tough time of the year for them. Just a word to those who are watching, those who are possibly listening in, on the dedication of healthcare workers and at least the due regard that we as communities can give to them by showing them respect, how to do that, how to support them.
Well, one thing which we expressed even in Boksburg was the fact that, health facilities don't exist for healthcare workers. They exist for the communities. So communities must take full ownership. They must be jealous. They should respect their healthcare practitioners. And that in itself encourages them to do better. So we also want to take this opportunity and salute all the women and men who continue to mend the fragile healthcare system, because it is our firm belief that without these foot soldiers, these frontliners, our healthcare system would have collapsed a long time. You would recall that from 2020 we had COVID, and we thought that this festive season would be better. But now we're facing this kind of situation. In the previous years, we've always dealt with, road carnage and all those things. But, I would be failing in my duty, Chairperson, not to express this and ask that, the community of Boksburg, Ekurhuleni, all stakeholders must not sleep on the job. Because one thing that disturbed me, Chairperson, was the fact that within a few days of this incident happening, we saw people announcing, figures. People were not even qualified, announcing figures of 18 million, which will be used for cables and on. In the midst of a crisis, it is said that we see people that see an opportunity to loot. I mean, what happened at Charlotte Maxeke, with the fire, we are still even struggling to get the hospital to fully function because of people who always see an opportunity to loot. So we want to take this opportunity and condemn those characters, and also say that one thing that they must know is that we are going to guard this process closely, and we're going to make sure that there's no looting that happens. And if there's any looting that happens, I think that government must be ready that at some point when people can't breathe, they're going to revolt. And South Africans are tired of corruption. We are also tired of corruption. And we call on everyone to go there and assist with a noble intention.
All right. Thank you so much for speaking to us. Simphiwe Gada, who is with Healthcare Professional Union, Nursing Union, DENOSA.